Good day. I am Michelle Jane Sevilla from BSN 111B, and for today, I am going to do an assessment of the cardiovascular system midterm demonstration. The cardiovascular system delivers oxygen, nutrients, hormones, and other important substances to the cells and organs of the body. It is important because it helps the body meet the demands of activity, exercise, and stress. So prior to the conduct of the procedure, first I'm going to review my client's medical records if available. Next would be to prepare the necessary equipment needed, which include a pen light to be used as a conventional light source, a rectangular card, a centimeter ruler, to measure the patient's jugular venous pressure, gloves, and of course a stethoscope. So the third thing to do prior to the conduct of the procedure would be to do the hand hygiene and wear gloves as needed to protect my patient and myself as well from infection and cross-contamination. Good day, ma'am. I am Michelle Jane Sevilla, your student nurse for today. And please state your complete name and your birthday, please.
Michelle Jane Sevilla, I was born on September 21.
Thank you, ma'am. So how would you like me to call you?
You can call me Jane.
Okay, Ma'am Jane. For today, I will be assessing your cardiovascular system, which means that I will have to check for your pulse on your neck, arms, legs, and of course, listen to your heart sounds. Will that be alright? So, do you have any questions or clarifications?
That's
So, would you mind if I close the doors so no one from the outside will be able to disturb you while we are doing the assessment? Okay. Okay, ma'am, is the room temperature fine with you or are you comfortable?
next time.
Okay, ma'am Jane, for a short interview, so do you have any specific complaints? Are you feeling pain in your chest or in your extremities? Have you experienced shortness of breath, dizziness, headache, or anything like that? Okay, so that's good to hear. And is there a history of hypertension, heart attack, coronary heart disease that has ever affected your family?
Not that I know.
Okay, so do you smoke?
No.
Okay, so what are your usual activities?
I usually clean the house. I water the plants, and I go out sometime, and I read too.
Okay, do you exercise?
Yes, sometimes.
Okay, ma'am, thank you. And now let's begin with your assessment. So now let's get started with the assessment of the jugular vein and carotid arteries. So inspections of these vessels can provide information about the blood volume and pressure in the right side of the heart. First thing to do is to position the client supine with the head of the bed elevated between 30 to 45 degrees, making sure that the head and the torso of the patient is on the same plane, which is the position of our patient now. Next would be to turn the patient's head slightly away from the right side being examined and shine a tangential light source onto the neck and suprasternal area and the area around the clavicles to observe any pulsations or shadows. So can you move your... So if jugular distensions is noted, assess for the jugular venous pressure by locating the highest visible point of distension of the internal jugular vein. And as deemed necessary, raise or lower the bed until the highest visible point of distension could be observed. Note that the jugular vein should not be distended, bulging, or protruding at 45 degrees or greater. If so, it may indicate right-sided heart failure. Now measure the vertical distance in centimeters above the sternal angle by extending a long rectangular cord horizontally from this point and a centimeter ruler vertically from the sternal and angle, making an exact right angle. So repeat on the other side. Proceeding now to the assessment of the carotid arteries with the head of the bed elevated at 30 degrees. Slightly turn the patient's head towards the side being examined and palpate for the carotid arteries, very likely to avoid blocking circulation or triggering vagal stimulation and bradycardia hypertension or even cardiac arrest. To palpate the carotid arteries individually because bilateral palpation of the carotid arteries may result in reduced cerebral blood flow. On the other side. So feel the amplitude of stroke and thrills. So next thing to do is to use the stethoscope and place the bell of the stethoscope over the carotid arteries and listen for a bruit. A bruit is a blowing or swishing sound that is caused by a turbulent blood flow through a narrowed vessel, which is an indicative of occlusive arterial disease. So ask the client to hold her breath for a moment and auscultate the carotid artery, listening for bruit. Can you move your hand here? And can you please hold your breath for a moment for me? And on the other side. Now, ma'am, I am going to proceed to inspecting your chest area. Proceeding now to the inspection of the heart or pericardium. So the first thing to do is to begin with a general inspection of the chest wall. So women keep the right chest straight and gently lift the left side of her breast with your left hand or ask the client to do this for her assistance. So stood at the right side of the patient with the head of the bed elevated at 30 degrees and look for any abnormal pulsations. So what I am looking for earlier is for any pulsation, symmetry of movement, retractions, or heaves. So heaves have a strong outward thrust of the chest, which I don't see. So now simultaneously inspect the pericardium for pulsations while palpating for the aortic, pulmonic, and tricuspid and apical area. So first palpate for hips or lift using palm or hold the finger pads flatly or obliquely against the chest. Now press the ball of the hand firmly against the chest wall and feel for thrills. Thrills is a vibratory sensation felt on the skin overlaying an area of turbulence, indicating a loud murmur caused by an incompetent heart valve. Now palpate for impulses using the finger pads flatly or obliquely on the aortic, pulmonic, tricuspid, and apical area. Now palpate for the apical impulse using or three finger pads. And for finer assessment, use one finger only to confirm the characteristics of the impulse. So if unable to palpate the apical impulse with the patient supine, then reposition the client to roll partly on her lateral side and palpate again using several fingers. So ma'am, can you roll on the other side? Okay. So if still unable to palpate for the apical impulse, then ask the patient to exhale fully and hold his breath for a moment. So ma'am, can you inhale, exhale, and hold your breath for a moment, please? Go. So ma'am, you can now breathe and return on your position. Now inspect and palpate the epigastric area. Now the next thing to do is to assess the heart rate and rhythm of the patient by placing the diaphragm of the stethoscope and on the patient's apical area. So the diaphragm is used for hearing high-pitched sound, while the bell is best used to detect or differentiate low-pitched sounds or gallops. Now, using the diaphragm of the stethoscope first, then the bell, listen for the patient's heart sounds on her four anatomic sites, which are the aortic, pulmonic, tricuspid, and apical area. So first, I am going to listen for her aortic area, which is found at the right sternal border and the second intercostal space. First is the diaphragm. And then the bell. Now moving to the pulmonic area, which is found at the left sternal border, second intercostal space. Now for the tricuspid area, which is found at the left sternal border, fourth intercostal space. And for the apical area, which is located at the fifth intercostal space, mid-clavicular. Then repeat these steps with the patient facing her left lateral side while the patient is sitting. So ma'am, I need you to roll partly on the left side. Ma'am, please inhale, exhale, and hold. So ma'am, you can now breathe and roll back to your lying position. And now I need you to sit down and slightly lean forward. Now inhale, exhale, and hold. Now you can back. Now ma'am, I'm going to be inspecting your arms and legs. So, okay ma'am, may I see your hand? Okay, your temperature is warm. Skin color is consistent. And on the other arm. The same, and the color is still consistent. So this time I am looking for venous pattern, lesions, and edema, which I don't see. Nail beds are pinkish, and I don't see your nails plugging. And on the other side, there are still no lesions and edemas or venous patterns. Also, nail beds are pinkish, and I don't see any clegging on your nails. So now I'm going to assess for your radial pulse, ulnar pulse, and radial pulse. Now, assessing for your papillary refill. So papillary refill is good. Now performing the Allen test, which is done to test the patency of the ulnar and radial artery. Okay, ma'am, I need you to open and close your hands as quickly as you can and squeeze it off. And then open. Okay, so I need you to do it again. And then open. Okay. Repeat the preceding steps on the other arm. Now proceeding to the patient's lower extremities. So I see that the color is consistent all over and the hair is evenly distributed. So your lower extremity feels warm. So now palpating for your pulse. I'm going to start at your popliteal pulse. So please raise your knee for me. On the other side. Okay. So moving on to your dorsalis pedis. So both are equally strong and has a regular rhythm. So now for your posterior tibial. So both are strong and has a regular rhythm. So now I am looking for any ulceration, edema, or swelling, venous pattern, or varicosities. Now palpating for firmness or tension in your calves. Now we'll have to do the dorsiflexion test to assess for deep vein thrombosis. So now for the capillary refill. Capillary refill is good. Okay, ma'am, we're now done with the assessment of your cardiovascular system, and just to sum up everything that we've covered, upon auscultation of your neck, I've heard no swishing or blowing sound. Pulses are equally strong, rated +2, which means normal. No trails noted, and your jugular venous pressure is at 6 or 8 centimeter of water with the pad elevated 30 degrees, which is good or normal. Upon assessment of your chest wall of your heart, chest movement is symmetrical, no retractions, no heaves or trills. Pulsations or vibrations are palpated in the areas of the apex, left sternal border or base, and heart rate is 75 beats per minute with regular rhythm. So upon assessment of your upper and lower extremities, arms are bilaterally symmetric with minimal vibration in size and shape, no edema, prominent venous patterning, skin is warm, capillary refill is good. Your radial pulse, ulnar and brachial pulses are bilaterally strong and has a regular rhythm, which is also very good. And upon performing the outlet test where you were opening and closing your hand, the result also was good. And upon examining your legs, hair is evenly distributed, skin is warm, no edema, lesions, and no swelling at your feet. Your popliteal pulse, dorsalis pedis, and posterior tibial pulses are all normal. They are equally strong and have a rhythm. So that's it. Overall, your cardiovascular system is doing very well. I suggest that you keep doing and consuming a healthy diet, healthy foods, and have a regular exercise, all right? Do you have any questions or clarifications? Okay, so that's it for today. Thank you, Miss Jane, for your participation in this assessment. So that's it for the assessment of the cardiovascular system. So after doing the assessment, we're going to perform hand hygiene.